Hello students, we will discuss today a important clinical entity. Look at this. What is this condition is? Look at the dorsum of the hand. There is swelling, redness, edema. Look at this like this. What it is called as? It is called as frog hand, like a frog belly. It is called as frog hand. Frog hand. So it is cellulitis on the dorsal aspect of the hand, may be associated with the lymphangitis. Remember, it's very common. This small redness area is lymphangitis. Why it is cellulitis? Features of swelling, redness, erythema. You know that calor, dollar, pallor tumor. So there is a feature. So what is defines cellulitis? It is spreading inflammation. This word is very important. Spreading inflammation of the skin and subcutaneous tissues and facial planes. The spreading word is very important. Remember when you defining the cellulitis. No edge, no pus, no fluctuation, diffuse features. Always examine ventral aspect and axillary nodes. Examine on the opposite side. That's important. Examine axilla. Examine if there is a frog hand here, cellulitis here. Examine. Sometimes it is a infection in the ventral aspect. It is very tightly packed and it won't swell. It won't get swollen that easily. And so dorsally it happens. Swelling. So maybe infection in the ventral aspect. Rule out that. Always examine ventral aspect. Always examine the axillary lymph nodes. Always examine opposite side. That's important. And how it is treated? Antibiotics, limb elevation, glycerin, magnesium sulfate. There is a liquid is there, glycerin and magnesium sulfate. Gel it is. So apply the gel over the hand up to here and elevate the limb. And it because of the osmosis, it reduces the edema. So that antibiotics and perfusion will increase. So it promotes control of the infection and also promotes healing. So there is an advantage of applying a glycerin, magnesium sulfate, local applicant, analgesic for pain. Limb elevation is very important. Initially position of the rest, eventually position of the function you have to use while positioning the hand. So what are the complications and sequelae? It may get localized to form an abscess. Remember, abscess is a localized collection of pus. Cellulitis is a spreading inflammation. That is important. Difference spreading word is important. Abscess localized. Septicemia, hand stiffness, osteomyelitis of the metacarpals, underlying bone. It's very common. Arthritis of this joint. Eventually stiffness can occur. Osteomyelitis can occur. So all those things requires a proper antibiotic treatment. You may have to take X-ray. Either there is osteomyelitis or not. Sometimes you have to do a Doppler. Currently, many places they do MRI, which is not that essential. But if there is suspicious of any real collection of pus, and MRI may be very useful. And proper antibiotic is important. And if antibiotic is not covering adequately, then you may have to do a incision and drainage under general anesthesia or regional anesthesia through the brachial plexus block. So that is important. So arthritis, all these complications you have to remember. So cellulitis and abscess, they are two different entities related to each other. That point to remember. Immunosuppression is also you have to remember. Diabetes is very common. So all those aspects you have to remember. So students, remember my clinical examination book with the video. It covers extensively in detail. It has got a instruments. It has got a specimen also. So which is again useful for your exam, practical exam. My surgical book again contains instruments, specimens, and MCQs also. CBM is covered per current syllabus. So it gives a surgical principles, operative surgery, how to do surgery, different principles of surgical technique of all surgeries. In detail, it is extensively detailed book. And tissue approximation skill with the video, it is there in the surgical tissue approximation. My DigiNeuro lectures, surgery, entire thing is covered, including clinical aspects, operative surgery, briefly, basic operative surgeries, instruments, specimens, and so on. Around 220 lectures. Please go through that, go through my book. So you'll have the very clear eye about all these things. Thank you very much. So students, I hope you understood that about the topic very well. Thank you very much.